At HealthCare Partners Medical Group, our mission is to provide the highest quality of healthcare to each and every patient. With 5 locations in Pahrump, we are local doctors you know and trust. We want to thank you for choosing us. Quality care starts here.
Some dementia is caused by chemical problems such as thyroid. So if someone is starting to get lost or to forget dates, best thing to do is to come in, because some of those, we hope a lot of them, but usually it's not a high percent, is caused by a low thyroid, and that could be completely reversed and completely corrected. Now, Alzheimer's disease is a diagnosis made by the symptoms. We don't have a good way to diagnose unless we take a brain biopsy, which we don't do. So after we exclude that there's no other source, we determine it to be Alzheimer's disease, but we're really never sure that it's Alzheimer's disease.
What are we seeing now as far as treatment for Alzheimer's?
Well, we do have treatments. There's approximately 4 medications approved by the FDA for treatment of Alzheimer's. Some are for mild to moderate and some are for moderate to severe. So we do have medications, but the important thing to remember about medication treatment for Alzheimer's disease, it does not stop Alzheimer's. It arrests the progression for a period of time, and generally you delay it for about 6 months, and it's always going to progress. We cannot stop Alzheimer's disease. We have no good treatments, but we can continue to expect a little bit of a decrease in the decline of functioning. That means that if you're already forgetting how to balance your checkbook, you're not going to gain that back. But you may be able to continue activities of daily living, functioning, getting around the house, taking care of yourself for a longer time because it's been delayed, but it still progresses. That's the important thing. We can't stop Alzheimer's disease.
Do you see anything medically in the future that they might be working on?
They've just introduced a vaccine to help with the progression of the deposition. We're not sure how this is going to work. Alzheimer's disease has been studied many years for many patients. Everybody wants to know how to prevent this. Ronald Reagan had Alzheimer's disease, and money has been pouring in. Lou Rovo Brain Center in Las Vegas has huge donations, but we're looking for these treatments, but we don't have treatments right now. The future, we hope that we can start to do this, but it's going to be on a molecular level. We have to get down into the cells, into where the genes, into where this the actual problem of amyloid is made, and stop that progression. So we do always hope in the future that we'll have better treatments, but at this point, that's all we have is the very basic medicine treatment.
Speaking of genes, is it hereditary?
Yes and no. The early onset tends to be more genetically related, but Alzheimer's disease does not mean that it's going to be passed on necessarily from generation to generation. So it has to be made entirely clear. Just because mom had it, that you're not necessarily going to get it, there's no reason to live in fear of that. The thing that you also may want to know is that Alzheimer's disease may be delayed by continuing to be mentally active and being physically active. And so if you want to prevent Alzheimer's disease, and the only thing we know is to be physically fit, be mentally fit, and doing things like the word search and the number games and anything like that probably is as good as anything we know right now to prevent Alzheimer's disease.